As we age, the upper eyelid loses its elasticity and becomes thin and crepey and can become redundant in the upper eyelid. So it drapes over and down to the eyelash. That's an aged characteristic. So the point of this surgery is to restore that youthfulness by removing that excess thin skin. So one of the most important parts of this surgery is very careful and precise marking. Okay, you want to make sure to mark the upper eyelid crease. Here I'm mimicking the eye opening and identifying the upper eyelid crease. Now, one of the most important parts again of the surgery is not removing too much skin. If you do, the eyelid won't be able to close. That's a condition called lagophthalmos. If the eyelid's not able to close, the cornea will lose its moisture and you can get a corneal ulcer and impaired vision. So a careful measurement is critically important in this surgery. If you look, the amount of skin between the lash line and the upper lid crease and the remaining skin between the brow and the upper lid crease is going to be approximately 20 millimeters. That's how much you want to leave behind to ensure that you get complete eye closure at the end of the surgery. The local anesthesia actually creates a little plane of dissection. This is called a hydrodissection, where the anesthetic itself separates the skin from the underlying muscle. When you're doing this surgery, you only want to remove skin. Removing excess muscle can actually create a hollowing and an aesthetically displeasing appearance. Okay, we've allowed about 10 minutes for our local anesthetic to work. Now we're going to start the procedure. We're going to begin by making our lower incision. My assistant Christine is giving me some counter tension. This usually takes one nice swift stroke. So we've made our incisions. Now the removal of the excess skin commences. We essentially want to pick the skin up, give us a little bit of a working edge here, and then dissect right under the skin, leaving all the muscle down. Here I've grabbed a bit of the nasal fat pad. This also tends to contribute a little bit to the appearance of fullness, especially in the medial eye. So what we like to do is tease it out gently. You don't want to be overly aggressive here. We tease out the fat pad and basically diminishes some of the fullness right there in the medial eye near the nose. We've removed the extra upper eyelid skin here. Our field is dry. Now it's time to close. The lateral and medial incisions, I like to close with interrupted sutures, and then in the middle I do a running subcuticular stitch. Cut, please. We're nearly complete with our subcuticular stitch. This is a stitch that's deep to the skin but over the muscle, and as you can see, it kind of zips the eyelid shut. Okay, we're all done. As you can see, the eyelid is stitched shut. The eyes have about 1 millimeter of lagophthalmos, which is exactly the amount that we want. Lagophthalmos is the space between the upper and lower eyelid skin. You can barely see a little bit of the eye. That's completely safe, and she's all done. Here are the stitches.
So much better. Wow.